Okay, please put your name and your professor in the chat. That would be great. So, uh, I would like this to be interactive, since this is a review for you guys. Ask questions. I hope you're using your HESI prep as a review. That has all the topics that are going to be covered on the HESI, and that's why I've been asking you to fill it out over the term. So I have pulled up a HESI review that that's what I would like to do today is review the topics and maybe try and figure out what kind of questions might be asked. You do have all the topics, but I don't know what the questions are. The HESI is done like NCLEX. It's pulled from a large bank of questions, but we do have an idea of what topics are covered over the last two terms. Okay. Does anybody have any questions before we get started? How are you prepping for your HESI?
I've been going back looking over like the study guides and stuff. I've been looking at the vulnerable population the most and kind of trying to test myself on those type of questions.
Great, great. And as I encourage my class this week, pull out your study guides, pull out your 3 study guides from your 3 exams and use those as well. So between your 3 study guides and your HESI review, you should be in good shape. Okay, what has everybody else been doing to prepare? First of all, everybody has well, you have to do it as an assignment. So have you been using the HESI guide, Emily?
Yes, ma'am. And
Okay.
yeah,
And
the study guide too. Yeah.
Okay, great. Awesome. Great. All right, I'm just going to share my screen and pull up the okay. So, what do we think? Everybody understand what anthrax is? This is under the section of bioterrorism. What do we think? What kind of question do we think we might get with anthrax? Maybe, what do we think?
Like what type of job they actually may work at if they come in contact with it.
Okay. Okay. What about maybe what they might present with?
Oh yeah, signs and symptoms.
Right? Cutaneous small sore that develops into the skin with a black center. Maybe what kind of side effects might they have? Right? GI. Maybe flu-like symptoms, chest pain, shortness of breath. And what about how is it treated? Okay, so we know you're going to get a question about anthrax. Okay, smallpox. What does smallpox look like? What might a client present with? Flu-like symptoms, develops into a rash with red spots. What's the difference between smallpox and chickenpox? Where might you see smallpox that you won't see chickenpox?
On the sole of the feet.
Sole of feet and hands.
Yep. Palms of the hands and soles of the feet. So be thinking ADPI here. What is it? In order for you to answer a question about a condition or a disease, you have to understand the disease and what it is. Okay, so for smallpox, flu-like symptoms, develops into a rash. How is it treated? Strict airborne precautions and contact precautions, right? And there is a vaccine, right? Do we know if there is a vaccine for smallpox? Right?
Yes.
And I just pulled up one student's that was, I went through and reviewed a lot of them. The students was very complete, so I wanted to pull this up and go through it. Another one, Ebola. Again, what is Ebola? How is it? How could it be presented? How is it treated? And how do you prevent the spread? That's simply what we're asking about these 4 bioterrorism agents. Okay, and sarin. What do we know about sarin?
It can cause respiratory distress.
Respiratory is the big issue with sarin, right? So please know what those 4 are. And again, in order to answer a question, you have to understand what each of them are. So my focus, if I were you, my focus would be, what are they? How are they spread? How do you prevent it getting out? How do you prevent the spread? How is it spread and how do you prevent it? What might a client present with, signs and symptoms? And how is it treated? So that's covering your nursing process. Disaster. We know that you're going to get a couple of questions about disaster. Based on last HESIs, they're asking 3 different questions. What's the difference between a level 1, 2, and 3 disaster? Disaster planning, red tag triage. So what kinds of questions might you get about distinguishing between a 1, 2, and 3 disaster? Maybe you're presented a case scenario and you have to identify if it's 1, 2, or 3. Okay, so here the student identifies what each one is. Level 1 disaster is a massive disaster that results in disaster declarations. Level 2 is the moderate disaster requiring federal assistance. Okay, and a level 3 is classified as a minor disaster with minimal damage. So I would know the difference between those 3. Okay. Why are you going to get asked about disaster planning? What do we need to know about disaster planning? Why is it important in community health? And what's our role in disaster planning as community health nurses? What are we doing?
Preparing for like any events that like is gonna
And who are
like
we who are we preparing?
the resident.
Right. And so what do we do? Remember we talked
Yeah.
about that survival kit?
Yeah.
Okay. Be prepared for self-survival. Know the disaster plan. You've got to know what the disaster plan is for your community, your workplace, and identify your duties. Know your community resources. Remember, nurses were asked to participate in all levels of disaster. What are the 4 stages of disaster? Prevention, preparedness, response, and outcome, or post disaster response. Right? So we need to be, it's important. Disaster planning is really a really important role for the community nurse. What about red tag? What's a red tag triage? What's red tag? You guys should know this. You filled out, you completed your HESI prep. What's red tag? Is that the walking wounded? Or is that the most severe cases, clients?
Most severe cases, emergency.
Right. Okay, red tag is a emergency, immediate threat to life. such as airway. So you're looking at safety, ABCs. Okay. So know what red tag is. Know if it's the most severe or the least severe. Then they want to ask you about epidemiology. Okay, certain infectious, conditions that spread in the community. The flu, COVID, SARS, those are the three. So again, I go back to, like we talked about, the agents of bioterrorism. Know what it is, how it's spread, how to contain the spread, how is it treated. And then certainly there was a question about CDC reportable diseases. Here's an example of a few of them. I can't imagine, I mean, I'm thinking maybe they'll ask about certain diseases or conditions that are pretty obvious that we know are CDC reportable, but they also might be asking just to make sure you're aware that in your community nursing role, there are reportable diseases. And you can't skip over that step. Hospitals report diseases, doctor's office report diseases, schools report diseases or report conditions to the health departments. They in turn report to state health departments that in turn report to CDC. And then we need to know the difference between vertical and horizontal transmission. What's vertical?
Like from the mother to the baby to breastfeeding or pregnancy of the birth.
Yep. 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 So it looks like they're asking about vertical transmission, not horizontal transmission. So you're exactly right. Mother-child transition or transmission, excuse me. Okay. With regards to health promotion and teaching, I added all these little bullet points here when I updated this for this term because these were more specific topics that were being asked about. So prevention of health problems. There was a question asked about infant death rates, about lipid screening. What do we think they're going to ask with regards to preventing health problems regarding infant death rate and lipid screening? Right? And remember, the topic here is health promotion and teaching. So what are we going to be doing with families? Teaching, right? Preventing birth defects by teaching new mothers on nutrition and taking vitamins, stay away from drugs and alcohol, talking about the risks of preterm birth, low birth weight, safe sleeping habits. And then what about lipid screening? Why do we do lipid screening? Why do we do lipid screening?
Because of family history.
Exactly. Yep. Yep. Recognizing alterations in health. Specifically, there were questions about conjunctivitis, diabetes, and eczema with school sports. So you've already learned about conjunctivitis during the term, right? So what is it? Okay. How do we treat it? Hand washing, treating with antibiotic drops, warm compresses. Recognize alterations in health regarding diabetes. So this is again in the section of health promotion and teaching. So what are we going to be teaching? with regards to diabetes? We're going to be teaching about making sure they know how to care for themselves, right? How to give their insulin, how to eat a healthy diet that keeps their blood sugar in check, how to monitor your blood sugar. And then with regards to eczema in school sports, what are we teaching? What are we teaching the parents or the students about eczema with school sports, commonly associated with asthma? Teach patients not to overdo in school sports. How is it treated? Creams, knowing the triggers to avoid them. Develop health practices that promote and support wellness, specifically heart healthy diet. What's a heart healthy diet? And what might you get asked about a heart healthy diet with regards to teaching? Anybody?
Is that
Limit
that
salt intake, or go ahead.
yeah.
Okay.
What I was saying is a diet which is low in fats and
Mhm.
salt.
Yeah. Yeah. Absolutely. So they asked a question about heart healthy diet. How do you teach a heart healthy diet? With regards to family health, elder assessment, family eco map, right? What do we do? Why is it important? What are the most important things to assess with an elderly client? Maybe risk for fall. What else?
I guess I would say like their mental state, maybe.
Mm-hmm. Mm-hmm. Both physical and psychosocial assessment, sure. And then what's an eco map? Do you guys remember what an eco map is? We had that week that we covered genograms and eco maps. What are genograms? Genograms are the history of the family going back 3 generations. Who had what condition, who had what disease, who died of what. So it's a genetic family history. Where an eco map, and they did ask about an eco map on one of the questions, you need to understand that the eco map is the social construct of the family within the community. Okay? Their social environment. Are they involved with the community? What are their connections to the community? Or do they live in isolation? Right? So a family eco map serves as a visual representation of the family's social environment. Okay. How much support do they have? Do they have family? Do they attend religious services? Do they participate in sports? Are they out and about in the community? It's really important when you're talking about family health. You want to make sure. I mean, what happened over the last couple of years with COVID? A lot of kids were isolated, right? The families really didn't have a social structure. They do now, but during that time, it was very limited. Their social kind of footprint in the community. Okay, adolescents. What are they asking about adolescents? Healthy people 2030 goals. Okay, you need to know the overall goals of healthy people 2030. Attain healthy, thriving lives, and a well-being free of preventable disease, disability, injury, and premature death. Okay, that is the overall goal of Healthy People 2030. That is right in this first sentence here. The other, let's see, Healthy People 2030 goals: primary prevention, screening, seatbelt safety. So there are questions on each of those bullets. Okay. Primary prevention. What's primary?
Preventing something before even
I was just
happens.
Yep. Great. What's secondary?
it's like a screening, like mammograms, bone densities.
Yep. I always think of secondary as early identification, early intervention. That's why you screen. And then what's tertiary?
The patient already has the disease.
Yep. Yep. Okay. Disease management. They asked about post cabbage, post arthroplasty, NG2 feedings at home. So this student gives a nice summary of each of those. Teach patients, this is post cabbage, teach patients to make exercise a daily routine. Don't overdo it. Stop if you feel short of breath, dizzy, or have any uneasiness. Stay hydrated. Wear comfortable clothes. Okay. With regards to arthroplasty, the goals are pain management, increasing mobility and function, reducing post-op complications. And then why are they asking about NG tube feedings at home? And they are, so what do we need to know? Ensure the position of the tube is correctly positioned for the patient in feeding. And what else do we look for with NG tube feedings at home? What happens if you see gastric content? What does that mean?
It's not ready for another feed tube.
Exactly. Yeah. Flush the tube before feeding with warm water to prevent any clogging. So the student did a nice summary of those 3 bullet points. Patient education, breast cancer risks, elder diet, home nutrition, program outcome evaluation, primary prevention, cancer. Okay. What are the risks of breast cancer? Getting older, genetic mutations, dense breast tissue, history of breast cancer, or family history. What do we want to teach elderly clients that are at home about their diet? Vitamin D, B12, fiber. Teach to pick foods with little to no added sugar, saturated fats, or sodium. Okay. Outcome evaluation. What's outcome evaluation? Assess the effectiveness of a program in producing change. It's part of your ADPI. Community outreach. They asked questions about Meals on Wheels, about the WIC program, and community risks. Okay. So the nice thing is you have all your topics here they're asking about. We just need to try and figure out what they're asking. What's occupational health? Let's see, we're in the section of, are we still in patient health promotion and teaching? We're still in this section. What's occupational health? Where are the nurses working?
They're trying to assist the patients with like ADLs for home, such as getting in and out the shower, things of that sort.
Well, occupational health nurse, occupational health
Oh, the
nurse
therapist.
is
I'm
in the
thinking about the
work
therapist.
setting,
I'm thinking about the
right?
therapist.
Right? The occupational health nurse works in the work setting. Her goal is to maintain the health and safety of employees. Environmental health. What are neighborhood safe houses? Why do we think they're asking about neighborhood safe houses?
For people that are abused.
Mhm. So know what a neighborhood safe house is and why it's available. Abuse and violence, suspected abuse. They're going to ask a question about suspected abuse. In elderly or child abuse, it must be reported. That's number one. We definitely know that. Right? Home health, hospice. We need to know the difference between hospice, respite. What's the difference between hospice and respite care? What's respite care?
That's where the caregivers get like time off to take care of their personal well-being.
Mm-hmm. Yep. And somebody will step in and help with that. Right? What's the most important thing for hospice clients?
Pain and comfort.
Pain and comfort. Pain control is the priority. Trying to help them control GI or respiratory distress is also extremely important. Trying to help the client maintain the dignity and their own dignity and self-esteem. Maybe providing guidance and support with a spiritual side. This is where therapeutic communication comes in. It's really important. Okay. Home safety assessment. Home safety assessment is an evaluation of your home to identify and eliminate potential hazards. We will be asked in community health nursing to do home safety assessments. Some topics under infectious disease that they asked about were HIV risk factors, HBV active immunity, hepatitis A risk. How is HIV spread?
Bloodborne, through needle stick.
Intercourse, sexual.
Yep. What about vertically through breast milk?
Yes, and pregnancy too.
Uh-huh. Okay. And then the other high risk for HIV is chronic STDs, right? What do we know about the HBV active immunity? Viral illnesses that attack the liver and it's bloodborne, right? Starting at birth, right? Getting vaccines. Hepatitis A risk. What's the risk with that? Men who have sex with men, daycare workers, and attendees, illegal drug users with chronic liver disease. And there's vaccines for that as well. PID risk factors. Many types of bacteria can cause PID. What is the most common? Gonorrhea and chlamydia infections.
Gonorrhea,
Yeah, yeah, yep. TB. What do we need to know about TB? Bacterial disease. Go ahead.
No, I'm just saying it's a communicable disease and it's
Mhm.
also a reportable disease also.
Absolutely. And we
And
screen through the TB
high
test.
risk for, I think, on the third reviews, like the prisoners, because they're in closed space.
Yep. 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 So we screen with a TB test. If it's positive, what do we do? Chest x-ray, blood work.
It's
So
also
there,
air.
go ahead.
It's also airborne.
Yeah. Yep. And then the last section was all the different vulnerable populations we reviewed over the term. Migrant farm workers, and the student gives an excellent summary of each of them. These are considered our vulnerable populations. We have migrant farm workers, rural populations, homelessness, and even more specific about homelessness, the question had something to do with cold exposure risks. So we think about hypothermia, frostbite. Another vulnerable population is clients who live in poverty, teen pregnancy, LGBTQ population, right? Clients with mental illnesses. The elderly in itself is considered a vulnerable population. And then with regards to alcohol, tobacco, and other drug problems, the question was more specific and it focused on secondary tobacco screening. Okay, so with that, alcohol and tobacco are major drugs of abuse. Vaping, e-cigarettes include addiction and nicotine progression to traditional cigarettes. They may also experiment with marijuana and opiates. Heavy drug use can interfere with normal growth and development. Right? So we try and identify it and put in place the appropriate interventions. Elderly, why are they at risk? So I'd be thinking with this section, vulnerable populations. Who are they? Why are they vulnerable? Why in particular are migrant workers vulnerable? Why in particular are rural populations? We know rural populations focus much less on health promotion, right? There's an issue with motivation and getting them to take an interest in their health, right? We know that lack of anonymity and confidentiality is an issue. Depression is high, violence is high, substance abuse is high. Okay. So be thinking about why people living in poverty are considered vulnerable. Why are teen pregnant clients considered vulnerable? Why is the LGBT considered vulnerable? Why are people with mental illness considered vulnerable? Okay. So that's your HESI study guide. Again, you have the whole left side are topics that came up in questions. So I would use your HESI study guide. This is recorded, so I'll send out the recording so you can see this particular HESI study guide as well. Use your 3 study guides from your exams over the term, and you should be good to go. Does anybody have any questions? I'm looking at everybody's name. I don't have one person on camera. So is this helpful?
Yes.
Yes.
Think nursing process. Okay? When you're tackling all of these, if it's a particular disease or condition, make sure you understand the disease or condition. You need the understanding of that to be able to answer the question. What questions do you have? Emily, do you have any questions? there any parts of the HESI prep assignment that you're struggling with? And that question goes to anybody. Is there anybody that's struggling with any parts of the HESI prep assignment? Okay. All right. Well, that's all I have. I'll send out the recording to the other professors as well so they can post in their classes. That's all I have. Hope that helps to review that.
Yeah, it did. Thank you.
Okay, thank you.
Yeah, you're welcome. You're welcome. Okay.
Thank you.
All right. You're welcome. Have a good day, you guys.
You too.
Okay.